Hi everyone, I'm Hadley and I'm a nurse. I'll be performing the head, eyes, nose, and throat exam. So for the exam, the first thing I want to do is gather my supplies. So I'd get my otoscope, a pair of gloves, and something for hand hygiene, and also maybe a notebook to write everything down. So I'd gather supplies. I would provide privacy for my patient. I would do my hand hygiene before going in the room. And then when I walk in the room, the first thing I would assess is general appearance. Is he clean, neat? How's his hygiene? Is his dress appropriate for the season that it is, and it's summer, so it is appropriate. The next thing I would look at is nutritional status. Is he dehydrated? Are his eyes sunken? Are his mucous membranes dry? And he looks well hydrated. I would look at muscles, any obvious deformities. Is he malnourished? Anything like that. I would also look at posture. I would look at positioning, posture, affect. What sort of mood does he seem to be in? He looks appropriate. He seems calm and cooperative, not combative or anything like that. The next thing I would assess, I can assess speech with my level of orientation, level of consciousness assessment. So I would say, what's your name, date of birth?
Keaton Knudsen, May 10th, 1994.
And I could verify that with his wristband, make sure that he's correct. Then I would ask him where he is and what year it is.
In your apartment, it's 2018.
Okay, and that's correct. So I know that he's alert and oriented ×3 and his speech is clear. So moving on, I would start with the head. So I'd start with inspection, making sure that the head is midline, looking at the hair, looking at eyelashes, eyebrows, making sure they're not matted, making sure that the hair is well kept, and it's evenly spaced on his head. There's no deformities of any kind. Then I would start with palpation. I'm just looking at the skull, checking for any lesions, any drainage, anything like that. I would move on to the temporal artery, making sure that you have a heartbeat there. Then I would move down to the temporal mandibular joint, have him open and close his mouth. After palpation of the temporomandibular joint, I would move on to the sinuses. So I would do the frontal sinuses and the maxillary sinuses. After inspection of the head and the hair, I would move on to the eyes. So I would start with inspection of the eyes. Just looking at the pupils, looking at the irises, looking at the cornea. I would use my pen light here to look at the cornea and just make sure that, have him look straight at the light, make sure that there's no cloudiness, no lesions. I could pull down on the bottom of his eyelids and look at the skin there, making sure that it is pink, making sure that the eyelashes are distributed evenly, and they are. His pupils look to be about 4 millimeters, which is normal. After I inspected everything, I would move on to checking peripheral vision with my confrontation test. So I'm going to get close to you and move my hands towards you, or towards the front of the room. Whenever you see them, you can say now.
No. No.
Okay, so peripheral vision is intact. The next thing I would do if I had the tool for it would be to check the red reflex, but I don't have the tool, so I'm just going to move on and skip that part. So now I'll assess the 6 cardinal positions. So just follow my finger with your eyes. The next thing I'm going to have you do is do the cover test. So you're going to take your left hand over your left eye, place it there for 1 to 2 seconds, and then go ahead and switch. And so I'm looking at this eye for any shift in fixation, and there's none. The next thing I would do if I had a Snellen chart is have him do the Snellen chart. So it's just a chart with a bunch of letters, and I would have him cover one eye and read. The letters get smaller as they go down. So he would read the smallest line that he could, and that would be a way to assess his vision to see if it's 20/20 or if it's less. So after I did the Snellen chart, I'm able to move on to the ears. So with everything, I would start with inspection. So I would look at the external structures, looking for any obvious lesions, any signs of infections, any drainage. Then I would go ahead and do my whisper test. And so just repeat anything you hear.
Baseball. Baseball.
Okay. And now I'm ready to use my otoscope and look inside the ears. So So I pull the, I would pull the pinna up and back, and I would look at the canal, and then I would look at the temporal membrane, making sure that it's a pearly gray, and it is. And then I would look at this side also, pulling the pinna up and back, visualizing the canal, and then making sure that the tympanic membrane is a pearly gray. And it is. So after the ears, I am now ready to move on to the nose. So I would start with inspection again. Looking at the nose, making sure it's symmetrical midline, making sure that there's no obvious lesions, drainage, abnormalities. Then I would assess patency, so I'll occlude one side, have him sniff, and then I'll check the other side, and they're both patent. Next thing I'm going to do is shine my light in here, looking at the mucosa, the septum, the turbinates, making sure that the septum is midline, and they are. So now I can move on to my mouth and throat portion of the exam. So the first thing I'm going to start with is inspection. I'm going to have you open your mouth. I'm going to look inside. I'm going to have you stick out your tongue, say ah. So I'm looking at the teeth, the gums, the uvula, making sure it's midline, looking at the tonsils, looking at the mucous membranes, looking at the palate, the floor of the mouth, checking the gag reflex. So I visualize the tonsils, so I can grade that as a 1. And then stick out his tongue. I was able to visualize the uvula, and that was midline. If I had gloves, I would palpate the inside of the mouth, but I don't have gloves, so I'm going to skip that portion. So the mouth looked good, so I can move on to the neck, which is the last part of our exam. So again, I'll start with inspection. So I'm looking at the trachea, looking at the looking at his thyroid gland to see if there is a goiter. So trachea looks midline. Thyroid, there's no obvious abnormalities or enlargements. So then I'll palpate, making sure that the thyroid isn't enlarged. I can check the carotid pulse while I'm here, checking for any jugular vein distension, masses, pulsation, checking the lymph nodes around the neck, around the clavicle. Next thing I'll have you do is range of motion. So I'll have you tuck your chin to chest, back up, and I'll have you look side to side, and then I'll have you extend your neck back. And is there any pain with the movements?
No.
Okay. And then the last thing I'll assess is strength. So I'm just going to have some resistance here with my hands. Turn your head side to side. Okay. And so strength is equal bilaterally. And that concludes our head, eyes, nose, mouth, and throat part of the exam.